Hello and welcome back. My name is Joseph Tsuma, and I'm here to bring you some trusted information wherever you are. So you can follow us for simple, practical, and reliable insights to keep you and your family healthy. You can subscribe to our YouTube channel at Dr. Wills. You can also follow us on our social media platforms at Zawadi Premier Hospital _ Ngong for Instagram and Zawadi Premier Hospital Ngong for our Facebook page. So today I want us to discuss a very important topic that several of you have requested me to address, that is anemia. And anemia basically cuts across. It affects all the people, all the ages, okay? Male, female, children, adults. It cuts across. So I felt it's very important for us to be able to have a candid conversation on who is at risk and how do you manage anemia and how can you prevent it. So, if you're new here, please consider following us as well. You can also follow me at a personal level on TikTok at Dr. Itsuma. So, before we dive into today's topic, I want us to start with some words of wisdom from the book of Isaiah, chapter 26, verse 4. And the Bible says, "Trust in the Lord forever, for the Lord your God, the Lord Himself, is the rock eternal." So no matter what you go through, you can trust in the Lord, because seasons may shift, situation may change, people may abandon you, desert or even betray you, but the one who remains constant through history is the God over history, and the Lord is unchanging and immovable, and nothing can stand against or overcome Him. He knows what it's like to suffer because He suffered for us. So we can trust God because He always keeps His promise no matter what. He has promised to fight for us, never leave us, and make a way for us. He has loved us and He protects us, and He remains faithful to us, even the many times we remain unfaithful to Him. Since God is our salvation, we can trust in Him and not be afraid. So, come. So, whatever it may come, okay, we can choose to trust in the Lord. Amen. So, let's dive into today's topic. So, what is anemia? So, anemia, we can look it in two different scenarios. So, anemia is basically, in layman's language, you can say it is low red blood cell count or low hemoglobin concentration. Now, red blood cells in our bodies, okay, they have what we call a protein called hemoglobin. Now, hemoglobin is the one that is responsible for carrying oxygen, okay, and delivering that oxygen to the rest of the tissue. So, in anemia, you can say either you have few red blood cells, okay, so the amount of hemoglobin each red blood cell is carrying is normal, but the number of cells are few, so basically you will end up having little hemoglobin, okay, or you can have normal number of red blood cells, okay, but then each red blood cell is carrying little hemoglobin. So if it's carrying little hemoglobin, at the end of the day you will still have low hemoglobin. Okay, so you can either have low red blood cells or low amount of hemoglobin concentration, and that basically is anemia. Now, if you end up with anemia, it means then it will lead to reduced oxygen carrying capacity. So you will not be able to carry enough oxygen to supply to the rest of the tissues that require that oxygen. Okay, and that in itself will have very many complications that we'll be discussing in the next as we continue. Okay, so the normal values for the hemoglobin, okay, for men, their normal values from 13.5 to around 17.5 grams per deciliter. That is normal. So below that, for men, it will be anemia. And then for women, it's between 12 to around 15.5 grams per deciliter. So below that, that one will be termed as anemia. And then for children, okay, it is between 11 to 13 grams per deciliter. So below 11, that will be termed as anemia. Now, a certain category of women, those especially those who are pregnant, okay, so their normal has gone down a little bit. So anything below 11 grams per deciliter, especially for pregnant women, that is termed as anemia. So you will see like a small discrepancy here. For pregnant women, it is anything below 11 grams. But then for normal women who are not pregnant, it is below 12. Now, that one is a big discussion. We can actually discuss that because especially in pregnancy, there is something called hemodilution. So your hemoglobin is diluted. So that's why the cutoff point, especially for pregnant women, is 11. Now, what are some of the causes of anemia? So, number one, you can either have decreased red blood cell production, okay, or you can either have increased destruction of the red blood cells. So, basically, you either have reduced production, or you have increased destruction, or you can have loss, so blood loss. So, when we talk about reduced decreased cell production, there are several causes, like if you have iron deficiency, you have vitamin B12 deficiency, you have folate deficiency, or you have taking some drugs that basically suppress your bone marrow, so bone marrow failure, or some chronic diseases like diabetes, hypertension that are not well controlled, okay? So you basically end up with some chronic the chronic disease basically will lead to reduced or decreased production of the red blood cells. Now, increased destruction, okay, mostly is any condition that causes hemolysis or bursting of those red blood cells. So, something like malaria, okay, increases the destruction of the red blood cells. Something like sickle cell disease, okay, increases the destruction of the red blood cells. Autoimmune diseases, okay, that basically attacks the red blood cells, okay, and some thalassemias. Now, all these we can discuss them in different topics, but they increase the destruction of the red blood cells. And then, lastly, blood loss. So when you have an acute loss of blood, now this blood can be lost either you have a cut, okay, you are involved in an accident and then you bled a lot, okay, or you have been doing your and then you cut yourself and you lose a lot of blood. So trauma, okay, this trauma can be what we call self-inflicting or uncontrolled, but also you can have surgeries, okay, that are done by the doctors. So someone went in for a cesarean section and they bled a lot, okay, or you had a procedure and you bled a lot during the procedure, so you become anemic. And then there are those people who basically have this chronic gastrointestinal bleeding. So when you're having bleeding in there, you have had this gastritis or even ulcers that keep on bleeding and you don't know, so you lose a lot of blood. And then the other time we talked about abnormal uterine bleeding. So menstruation, when you menstruate and you have prolonged heavy bleeding during your menses. At that time we are talking about uterine fibroids, which can actually lead to prolonged heavy bleeding with intramenstrual bleeding. So basically you end up with blood loss and that one can cause anemia. Or basically have infections such as hookworm infection, okay? So hookworm can suck that blood and then you basically have consistent blood loss and that one can actually cause anemia. So the types of anemia, okay, so you can either have what we call microcytic hypochromic. So micro means the red blood cells are small, okay? So they are not the normal size. They are more smaller than the normal size. And then hypochromic, it means then the concentration of hemoglobin in that red blood cell is low. Okay. Now, what are some of the types of anemia that can cause microcytic hypochromic? Number one is when you have iron deficiency anemia, and then thalassemias, and as well as chronic blood loss. And then we have the normocytic, normochromic. So the red blood cell is of normal size, okay? It is of the normal concentration. The hemoglobin in each red blood cell's concentration is normal, okay? But then you have reduced number of red blood cells, and that one basically happens mostly, especially when you have acute blood loss. So you lose a lot of blood acutely, like during trauma, surgery, menstruation, and all that, okay? Or you have chronic disease, okay? Or even bone marrow suppression. And then we have what we call macrocytic or megaloblastic anemia. So the red blood cell, okay, is abnormally big, okay, but it does not have the right concentration of hemoglobin. And most of the time, this is when you have deficiency of vitamin B12 or even folate, okay? When you have liver disease or even hypothyroidism can actually cause macrocytic or what we call megaloblastic anemia. And then we have other special cases or special types like aplastic anemia. Now, in aplastic anemia, you have suppression of all the cell lines. Okay, so here you have bone marrow suppression, and you say the bone marrow produces red blood cells, it produces white blood cells, and it produces platelets. Okay, so the red blood cells carries oxygen, white blood cells help to fight infections, and platelets help to clot the blood when you start bleeding. So in aplastic anemia, you have bone marrow suppression, and therefore you will have suppression of all the cell lines. And then other types include sickle cell disease, okay, so whereby the red blood cells themselves are defective. Okay, so how do patients present? So number one is they will present with fatigue, just general body weakness, shortness of body, because they are not able to carry, their hemoglobin level is not enough to carry oxygen to the rest of the body. So what happens is they will present with difficulties in breathing, and then they will be aware of their heartbeat, palpitations. Okay, so someone tells you, actually, I can feel my heart is beating. Okay, because now the heart is beating a little bit faster to try and push enough blood, okay, to supply enough blood, because now you don't have enough blood, so you have to pump it faster so that you are able to get to the rest of the body. Okay, and then dizziness, okay, headache, persistent headaches, okay, dizziness, blurring of vision, palpitation, shortness of breath, weakness, okay, and even fatigue. You just feel tired. Those might be the only symptoms that someone might present with anemia. And then when you come to the hospital, some of the things that we'll be able to pick out from the body is paleness. Okay, so pallor on the palms of the hand, okay, the soles of the foot, the conjunctiva, okay. When you look at the nail bed, okay, it will be markedly pale, and then there will be reduced capillary refill as well. And then when you listen to your heart, you will feel tachycardia. So basically the heart rate will be markedly elevated. Then the nails might be a bit weak and brittle, so basically you can actually break the nails, what we call the brittle nails. And then sometimes you can examine around the mouth, you'll find some inflammation of the tongue, what we call glossitis. Now, if the anemia is caused by destruction of the red blood cells, like what we call hemolysis, then basically patients will also present with jaundice or the yellowish discoloration around the eyes, the sclera of the eyes, but also in other mucous membranes. And then with chronic anemia, you can have some patients present with chronic leg ulcers. So wounds around the legs that are not basically healing. Okay, so when you come to the hospital, what do you normally do? So there are some tests that you normally do to basically, first of all, confirm the type of anemia that someone presents with, and then basically that will form, okay, the basis for the management. So number one, we'll do a complete blood count, and we have some indices that basically will help to determine exactly the type of anemia that this person is having. And then, of course, we will also do some iron studies. So basically looking at the amount of iron that you have, and then vitamin B12 and folate levels, okay? And when we have not been able to find exactly the type of anemia, we can actually go ahead and do bone marrow aspiration. Okay, so that we're able to basically look, are there any signs of suppression of the bone marrow and all that. Okay, now the other test that basically, especially if you're having what we call chronic blood loss that is not visible, like let's say for example you're bleeding inside, okay, there is you have an ulcer that is bleeding, so basically you might actually need an endoscopy, okay, or you can even take your stool and do stool for occult blood to be able to know exactly where the loss is coming from. What are some of the complications of anemia? So number one, of course, severe hypoxia. We talked about difficulty breathing, okay, but then that increased heart rate, when the heart is pumping so fast than normal, okay, it can actually lead to heart failure. When you lose a lot of blood, you can actually go into hypovolemic shock, okay. And then for children who have persistent anemia that is not corrected, they can actually lead to growth restriction or retardation. So they will not be able to grow to the normal desired size, okay, so they will be retarded in their growth. And then we talked about anemia that basically affects the bone marrow, where you have suppression of the bone marrow. Okay, so when you suppress the bone marrow, it means you'll have reduced red blood cells, reduced white blood cells, and also reduced number of platelets. So what happens? You will have increased tendency of bleeding. So you will bleed a lot when you cut yourself, but also there will be increased tendency of infection. So someone basically will be prone to infections. Small infections that are not affecting the normal population, this person who is anemic will be affected. And then there are those pregnancy complications, okay? So heart failure, growth restriction, increased bleeding, especially when you are during time of delivery and all that. And then for patients who have folate and vitamin B12 deficiencies and who get pregnant, their babies can actually develop some neurological defects because of untreated anemia. So how do you manage? So number one, of course, you need to identify the cause, and then basically that will form the basis for the treatment. Some of them will just need some nutrition counseling that will be able to help supplement either iron, folic acid, or even vitamin B12, and you're good to go. So for iron deficiency, you need to supplement with iron. Okay, vitamin B12 deficiency and folate deficiency, you need to supplement with vitamin B12, you need to supplement with folic acid. For hemolytic anemia, you need to treat the cause. If it's malaria, it needs to be treated. If it's systemic autoimmune disease, it needs to be treated. Okay. Now, for aplastic anemia, okay, which is basically bone marrow suppression, it could be because of either a tumor in the bone, okay, or it could be you've been using some drugs that ended up suppressing, especially the chemotherapy drugs. They suppress the bone marrow. So basically, you might need bone marrow transplantation, or even you may need some, or if it's as a result of an autoimmune disease, then basically you will need immunosuppressants to be able to suppress the immunity so that the immunity does not attack the bone marrow. Now, in severe cases where you have lost a lot of blood, transfusion will be required. Okay, so by far those are the general management. So how do you prevent? Number one, of course, nutrition. Okay, you need to eat balanced diet, take good food that is rich in iron, folic acid, as well as B12. The second thing we talked about hookworm. Okay, so worm infestation that can actually suck a lot of blood in your intestine. So regular deworming. How many times do you deworm in a year? Okay, so at least every 6 months, 6 to 12 months. Okay, I know there are people who can go years without deworming. They are okay, so they think that everything is okay. But Regular deworming, very important, okay? Now, for our mothers who go for antenatal care, please, okay? Take good care of yourself and take those supplements the doctor is giving you because they are rich in iron, they are rich in folate, okay? Now, that folate is very important for the development of that baby to prevent those neurological defects. So, please be courteous enough and take those supplements, okay? And then there are those people who have chronic diseases like diabetes, hypertension, okay? That can actually affect the kidneys and all that. Please ensure that you take your medication religiously, okay, to control those chronic diseases that can actually lead to anemia. And of course, screening, very important, especially for conditions such as sickle cell diseases, okay, the thalassemias, and as well as immunosuppressive diseases such as systemic lupus erythematosus. So by far, that is what you need to know about anemia. Now, if you have found this class or this presentation very helpful, please head to YouTube. You can watch it there, the complete one, okay? And you can subscribe to our YouTube channel at Dr. on Wheels. You can also follow us in our social media platforms at Zawadi Premier Hospital _Gong for our Instagram, and Zawadi Premier Hospital Gong for our Facebook page. Now, if you feel any of these symptoms that we have discussed here, please do not hesitate to visit us at Zawadi Premier Hospital. We are located at Lupsil Center in Gong Town, opposite Juango Petrol Station at ground floor, and we will be able to assess you, okay? And we will be able to give you quality care that you require for you to be able to live a healthy living. Okay? Until next time, God bless.